Every child deserves the best start in life. The early years from birth to age 5 are critical for cognitive, emotional, social, and physical development. These formative years lay the foundation for a lifetime of learning and growth.
When we talk about quality in early childhood, it should be in relation to the services these children are getting. And the services revolve around 5 nurturing care components. That is having good health, adequate nutrition, responsive caregiving, safety and security, and also being given opportunities for early learning.
We have a lot of evidence saying that our brain is being formed and developed in the first 3 years of life. Actually, 80 to 90% of our adult brain is already developed in the first 3 years of life.
So when you look at children, if a child is not breastfed for the first 6 months of life, it means that they are not getting the right nutrients for growth. And I mean growth including the brain development. So especially for the formative years, their psychomotor development, their brain development, their physical development is what they are fed on. So we are looking at the food they eat, the nutrients of concern. Are they accessing iron for brain development? Are they accessing calcium for bone health? Are they accessing folate for their spinal development?
Childcare takes many forms, each tailored to unique circumstances, from home-based to center-based care, offering unique approaches to personal and institutional childcare. In rural areas, unique challenges shape caregiving practices, while preschool childcare plays a pivotal role in early childhood education.
What we find, I think, consistent across all settings is that there is this deep desire to learn for training opportunities. Majority of providers have been providing services for roughly between 3 years to 5 years, but under 4% have received any form of training.
Actually, in Kenya, there is no curriculum. So it means there are no standards. Everybody is doing their own thing. So NITA came in to ensure that we develop a curriculum to standardize the process in the sector.
Additionally, caregiving under extreme conditions such as that of street families and women in prison highlights the resilience and adaptability of childcare solutions in the face of adversity.
It is very difficult for them to have 3 meals in a day. They need proteins, they need carbohydrates, all the nutrients in their lives in order to produce milk and in order to make sure that this kid has all the nutrition that they need.
Challenge ya kwanza, wengi wao ni positive. Challenge ingine ni wakipata watoto. Ule mama akilala pale nje, ule mtoto anagonjeka pneumonia. Hao watu ati kupata hizo chanjo zikiwa zimefuatana inakuanga tricky.
In all the Kenyan prisons that have female facilities, we admit women with children accompanying them to prison between the ages of 0 and 4. We have a daycare that is fully furnished and modern with everything that is required in a modern daycare. And for the lactating mothers, we have a maternity wing for them, and we also able to provide for both postnatal and antenatal care for mothers with children.
As a country, we rate ourselves, especially in the region, as one of the best countries in terms of childcare. We have just had our Children's Act 2022 enacted, which is a very progressive law. In the middle of its implementation, many other programs also are going on as far as our children are concerned.
When it comes to creating an enabling environment, that has basically happened in the form of laws having been passed since the promulgation of the new constitution. And then we also have had policies that have come into play. We've also had regulations that have been developed, that support work within the space. And we are seeing the counties constantly continuing to, improve in the area of making sure that we have standards that would not allow for quality services to be delivered.
We have very elaborate plans and designs to create spaces for play, spaces for social gatherings and all that, and this is going to improve the facilities.
We are proud as a county government of Siaya that we are leading in terms of nurturing care. We have a program called Smart Start Siaya, which has now been replicated in about 8 counties in the Lake Region Economic Bloc.
At present, we've actually gone in Vihiga, we've already developed a bill which has even gone through even the public participation on the child care, and it's about to be out.
We've come up with baby care centers fully funded by the county government of Nakuru through the initiative of the governor, Her Excellency Susan Keheka.
For us who have been in the space for a longer time, we are excited because now people are recognizing that foundational stage is very, very important. So it is positive to the learners, particularly those ones who are in the bracket of 3 to 5 years.
The ECD Network for Kenya is a membership organization which was established in 2015 and launched in 2016 and registered in 2019. The network was established when we realized that there was a gap in coordination of ECD initiatives in Kenya. And we realized that those who are working on health focus on health, those in education focus on education, those in nutrition. So everybody was focusing on their, without knowing what the others is doing. And because of that, we thought all of them are focusing on one child who requires all these services. So we came in as a network to synergize, to bring all this together. And that's how the network was started. And what we do is to create forums that brings together policymakers, program implementers, parents, to be able to explore how best can we make the early childhood stage get the firm foundation.
The journey toward comprehensive early childhood development in Kenya is ongoing. With collaborative efforts, we can create a future where every child, regardless of their background, has the opportunity to grow, learn, and thrive.